Thank you, Mr. Chairman, for your leadership, and thank you, Deputy Secretary Hargan, for your presence here today. Medicaid provides health coverage to 7.2 million low-income seniors who are also enrolled in Medicare. Is that correct?
Medicare serves tens of millions of people.
The answer would be Medicaid provides health coverage to 7.2 million low-income seniors, correct?
Yes. I'll take your number as being accurate.
Roughly 60% of all nursing home residents receive Medicaid coverage. Is that correct?
I'll take again your number as being accurate.
Do you think that nursing home care is an important part of our healthcare fabric here in the United States of America?
Yeah, all different kinds of post-acute care settings are important. Skilled nursing facilities, long-term care facilities, home health. We seek to make sure that whatever setting Americans want and choose what's best for their care is enabled.
So nursing home care is important, correct?
Nursing home care can be important for the right senior.
Close to half of all long-term care services for the elderly are paid for by Medicaid, true?
It's an important component for individual nursing home payment.
Medicaid also covers premiums, deductibles, and cost sharing for Medicare beneficiaries. Is that correct?
In certain settings, yes.
Medicaid provides coverage to 27 million children under the age of 18 in the United States of America, true?
Again, I'll take your numbers to be accurate.
More than 700,000 children in Medicaid expansion states gained coverage between 2013 and 2015. Is that correct?
I'll take your numbers as accurate.
And research shows that children with Medicaid coverage have better health care outcomes as adults. Is that true?
Could you repeat the question?
Research shows that children with Medicaid coverage have better health outcomes as adults than those without Medicaid coverage, correct?
I'm not familiar with that research.
Okay, but the totality of the import of what Medicaid provides, I think, is well established, and you've agreed in several different areas that Medicaid is covering a substantial number of Americans, from children all the way to low-income seniors and those who are receiving care in nursing homes. So for the life of me, I'm struggling to try to figure out why this administration proposes essentially to slash $1.5 trillion in Medicaid and create a smoke and mirrors block grant program that will devastate the ability of these recipients who rely on Medicaid to receive care. Now, the president, during the campaign, promised that he would not touch Medicaid. Is that correct?
The president is fully committed to supporting the Medicaid program.
Why is the president breaking his promise, not just with respect to Medicaid, but also Social Security and Medicare, by submitting a budget that would cut approximately $2 trillion?
The budget proposes a shift into a $1.2 trillion new program to allow states to flexibly deal with the most vulnerable populations that Medicaid was intended to address: the elderly, the disabled, pregnant women, children. So we're fully committed to that, and it's a $1.2 trillion new program that we are advocating for in this budget.
And you propose creating this $1.2 trillion new program because you want to address alleged waste, fraud, and abuse in the current Medicaid program. Is that right?
We want to make sure that states have the flexibility in the new program to address the unique needs of their populations and focus the program on the traditionally vulnerable, fragile populations that Medicaid was intended to address from its very beginning.
Okay, so at minimum, even if we assume that this new $1.2 trillion block grant program is going to actually reach the people who are currently being served by Medicaid, which there's reason to doubt, you're cutting at least $300 billion from Medicaid. Can you give me a single example of the type of waste, fraud, and abuse that you are trying to address that would justify billions of dollars in cuts? Not millions, not tens of millions, not thousands, billions of dollars in cuts. Can you give me some understanding of the waste, fraud, and abuse that you're addressing?
Actually, over 10 years, Medicaid spending goes up under this budget plan. So we are not addressing actually a lowering in the budget of Medicaid spending, but actually increasing
Can
it.
you give me a single example of the waste, fraud, and abuse that justifies cutting billions of dollars from children, low-income seniors, and those receiving nursing home care?
Our Inspector General and our Centers for Program Integrity are constantly working to identify areas where there are waste, fraud, and abuse that take place throughout our programs. We have entire...
Reclaiming my time, I assume that's a no. I yield back. Thank you.